Dear professors, dear colleagues, dear friends, thank you for your coming to the EQUIP meeting at the first time organized in Croatia. And on behalf of the director of the Agency of Quality and Accreditation in Healthcare, I bring his very warm greetings to you. And my duty is to show to you the structure and functioning of our Agency for Quality and Accreditation in Healthcare in Croatia. I want to repeat that our University of Zagreb and our School of Medicine support us for the participation at the EQUIP meeting last 10 years, and our university, our School of Medicine, Ministry of Health, Ministry of Science, Agency, and especially EQUIP help us in the organizing this EQUIP meeting in Zagreb during these 3 days. What to say at the beginning about Agency for Quality and Accreditation in Healthcare in our country? It is a professional and independent public non-profit institution established in 2007 by the Act on Quality in Healthcare. But officially, Agency started to work in 2009, and the main goal of the agency is to establish quality and safety in healthcare through the planning, implementation, and evaluation of measures to ensure, improve, promote, and monitor the quality of healthcare at all levels, and primary health level too. What to say about activity of the agency? Agency conduct the procedure of the granting, renewal, and cancellation of accreditation of healthcare providers, propose to the Minister in cooperation with professional association the plan and program for healthcare quality assurance, improvement, promotion, and monitoring, propose the propose the healthcare quality standards to the Minister, propose to the Minister the healthcare quality standards on the primary health level 2, propose the accreditation standards to the Minister, conducting the procedure of assessment of healthcare technologies, keep a register of accreditations and providing a database related to accreditation, healthcare quality improvement, education and evaluation of medical technologies, provide education in the field of healthcare quality assurance, improvement and promotion, supervising the healthcare insurance standards, and provide other services in the field of healthcare quality assurance, improvement, promotion, and monitoring according to the Act and regulation based in our country. At this slide, you can see the position and form of the agency. In the middle is the director, and he or she collaborates very closely with the director's office, stakeholders, and management council, and organize the work of the agency through the Department for the Accreditation, Department for Quality and Education in Health, and Department for Development, Research, and Health Technology Assessment. What are the duties of the Department for the Accreditation? To develop and improve accreditation standards, the development of procedure for assessment of the standards, self-assessment, external evaluation and training of evaluators for accreditation procedure, in collaboration with the Department for Quality and Education in Health, development of educational programs for hospitals, management partners and institutions and non-hospital setting, preparation of accreditation reports, and development of conducting a database and register of accreditation process. What are the duties of the Department for Quality and Education in Healthcare? First, establishment of obligatory system of healthcare quality and safety through the uniform system of quality and safety standards, and clear definition of clinical quality indicators. Another duty is to develop educational programs for the stakeholders, researchers and healthcare providers, managing program for improvement of healthcare quality and safety, promotion of the healthcare quality and safety culture, and our situation in our country and our context, and proposing and providing clinical protocols and guidelines. It is very important to say that we need uniform system of healthcare quality and safety standards and clinical quality indicators, and in this job agency prepared the ordinance of standards of healthcare quality and the method of their implementation, and the manual on standards of healthcare quality and the methods too. In this ordinance, we can find the 9 obligatory generic standards, and you can see that it is a continuously quality improvement of clinical and non-clinical procedures, patient and staff safety, medical documentation, patient rights and experiences, staff satisfaction, infection control, deaths and autopsy, monitoring of drug side effects and adverse events related to the medical devices and products, internal ratings and supervision of healthcare quality improvement and assurance system. In the manual of standards of the healthcare quality and the method of their implementation, I can say that it is a new document in our country. We can find the healthcare quality indicators for primary and secondary healthcare system, patient safety indicators, questionnaires of patient satisfaction in primary and secondary healthcare and satisfaction of the staff, and templates for monitoring of healthcare quality indicators. I think that this manual will help us in the process of the accreditation and definition of the indicators and standards. What to say about healthcare quality indicators for primary healthcare family practice? The people who were involved in this producing of the manual defined the next healthcare quality indicators for primary healthcare. It is percentage of diabetic patients with hemoglobin under 7%, percentage of patients treated for hypertension with blood pressure lower than 140/19, vaccination of children in primary health care, and percentages of adult systematic reviews. What to say about accreditation process in Croatia? It is a voluntary procedure, and our agency tried to organize our own model of education for our context and organize education of educators and education of hospital staff. Now, our agency started with introduction and accreditation system in a hospital system and hospital setting, and all activities are based on the manual of accreditation and bylaw of accreditation too. Which institutions are involved in the process of accreditation? Ministry of Health, Croatian Institute for the Health Insurance, healthcare providers, and Agency for Quality and Accreditation in Healthcare, and they make one circle and work together at one aim. What to say about ordinance of the accreditation standards for the hospitals? Because now it is in a process in Croatia. They defined 10 accreditation standards for the hospital setting. They do that and they use that in the accreditation process. And it is the reason why director is not here with us today at our meeting. They are very proud on the accreditation for the 10 hospitals in this year. It is a public process and public application for accreditation. They involved 10 hospitals in process of the accreditation, one clinical hospital, one clinical hospital center, 2 clinical hospitals, and 7 hospitals, and costs of accreditation procedure for 10 elected hospitals are funded by Croatian Institute for Healthcare Insurance. What to say for the future and for the family medicine setting and for us? Our directors says here that in the next year we will have to organize and create accreditation standards for the primary health care, that we will organize education of primary healthcare staff and accreditation of healthcare centers. We will remember this slide and we will see what will be happened. And at the end of my presentation, I want to say big thanks to all of you, and special thanks to Professor Helen Lester, colleague Rob Dixie from the Netherlands, Sarah from the Aqua Institute, and all of you who decided to participate at this conference and share with us your knowledge, your experiences, and help us in the preparing and enabling us for the process of the accreditation and defining of the standards and indicators in our small country. Andrea Štampar opened the health system for the population, and EQUIP open to the population in the country of the organizing EQUIP meeting here, and I hope that we will spend useful time here in Zagreb for the 2 days.